Okay, so this group meeting is we can start talking about our clinical sites and anything that we want to note about them, and then we can get into the implementation part of it. Does anyone have anything cool to say about the clinical site?
I started a new job and it's super hard and I don't know. It's
Why
really
is it super hard?
because there's a lot of sketchy politics involved.
Well, that's fun.
Like I learned that $1.5 million has just randomly gone missing. They basically fire people for getting hurt, and they would rather have recordables than slow down production. So we have our recordables are just bonkers.
What are they?
Like numbers.
Yeah, ballpark.
I think last month there were like 20.
Do you know how many year to date?
A lot. I don't know off the top of my head because
What month are we in?
like ATI, my company's numbers don't fully match with the other companies or with my client company's numbers because they are sketchy and they lie. Like if someone like we had someone go today who was prescribed 800 milligrams of ibuprofen and that was not recordable.
Oh,
It
yeah.
should be recordable. So don't ask why. Just know that it's sketchy and they hired a safety person and they're paying her about $40,000 less than the previous safety guy who didn't even have a college degree and she has a master's. And so like she doesn't really know what she's doing. I mean, she knows what she's doing, but like they're not allowing her to do anything because she's basically a woman. So it's not a super fantastic situation, but we're gonna conquer these challenges.
So how does that directly affect like your practice?
So health and safety, we should work together. If somebody gets hurt, I should be working with her to identify the root cause of the problems and prevent those injuries from occurring in the future. And part of the contract between my company and my client company is that I'm basically not allowed to have a relationship with the EHS person.
That's written in there?
I was told by my boss to not go outside of my contract.
But if it's not written in your contract,
I mean, maybe it's not my contract, but maybe it's the contract that they have with the, like my company has with the client company. Because he was basically just like, do what you're told to do, don't do anything else. And I've not been told to interact with the EHS person, but like I really like her and we get along. We're both young, like gung-ho professional people who know what we're doing, and we really have these like optimistic hopes and dreams. And yeah, it's a questionable situation.
I think this is something you could definitely build on, Spencer, though, if you have a great relationship with her already in the short time you've been there. I don't know how far you guys got in that hour-long video that Dr. Powden posted, but it had a good point on the 7 steps. And first and foremost, we have to build relationships, right? It wasn't exactly build relationships, but essentially it was make it marketable. So if you don't get people on your side or on board, it doesn't matter how great your plan is. And I don't want to say you and other lady are going to have to kiss ass to other people in the company. Don't mistake me. But sometimes befriending them, yeah, sometimes just that befriending allows you to do a little more than what is on paper.
Well, this situation's unique. I don't know how you, Julia and Annette, I don't know how your companies work, but our HR over is like here, then safety is here underneath of HR. So HR has the final say on everything. Is that recordable? Is that not recordable? HR makes that call, not safety, not health services. And I'm not even technically health services. I'm called the first aid room. And so I'm a nobody. They keep saying, my company keeps telling me to say, I'm a guest in this house.
So we actually have a similar model, but a lot more functional, it sounds like. In that, I'm not sure if she's technically HR, but we have a DMR, disabilities management representative or something along those lines, who she is the one who investigates. So it's not EHS at all, and it's not us at all. And then there is EHS, who we actually do work with though, mostly because we don't have access to any numbers, which is super helpful in preventing injuries. So they pull the numbers for us and give us the data, and then we can use it. And then, yeah, we're first aid. Everything we say says we are OSHA first aid. So,
But it sounds like the DMR person actually has like experience with ergonomics and health and safety type stuff, maybe.
she's got experience with paperwork and legality of things,
Oh, okay.
not health and safety. She's
Well,
not health and safety.
fantastic.
Yeah. So it's actually a similar setup, and it can work. It does work. I would say definitely don't get involved in whether something's recordable or not. Like, we are hands off. If somebody, like if the DMR comes up to us and asks, hey, when did they say this happened to you? What I'm allowed to say to the DMR is, this is the time that the patient was seen. This is the day the patient was seen. This is how long they were in here for. And that's it. I can't tell them anything that they've said to us in our documentation. That's an entirely different, like, investigation that we just keep our hands as off of it as possible.
I mean, this place is just a walking death trap, and the company would rather pay out healthcare bills and legality fees than deal with the problems. Like, I could go on for days, but I'll just say someone chopped their hand off, and instead of taking responsibility for it, they essentially cornered another employee into a back alley and essentially had him sign a document saying it was 100% his fault. So if the employee tries to sue, she will effectively be suing a poor teammate instead of the company. And then OSHA only fined them $2,000. So my company is just like, hell yeah, we're going to pay that $2,000. Bye. Move on. Anyway, enough about me. How about you guys?
Well, my problem in the industrial setting seems a little less important. I said in my video to Dr. Powden last week that one struggle I have is just the the warehouse mentality. So all the coworkers say, we're too busy, productivity, numbers, I gotta get this, and that's their excuse to not housekeep or clean up things like shrink wrap. So they cut the shrink wrap and they'll leave it there as opposed to putting it in the recyclable. Broken pallets everywhere. There's been a couple times where there's nails in the pallet, and I think that drives me insane more than anything. Is somebody could step on that, and now not just a slip and fall, we have a puncture wound. So my whole thing was, what can I implement or propose to make it less of a problem, where we attack the attitudes? I don't want to say attack the attitudes, but we address the oblivious attitudes that we have versus, something in the treatment center. We call it a treatment center to your first aid room, or a practice like that. And so Dr. Powden had really encouraged me just to think about ease of implementation too. So, can it be something as simple as putting another trash can, even though there's already one in the row? Can we put a second trash can farther down the row or aisle and get a better result? And so I was excited. I'll count this as my success story, to go off the general questions here, but I felt comfortable telling the safety supervisor that, hey, if he's frustrated and I'm frustrated, we're all frustrated with the dirty warehouse, maybe let's make it easier for them to throw away trash. Can we put another trash can and recycle at both ends? So it was received well, but the safety supervisor's easy out was, okay, I'll forward this to the shipping managers and then they can decide. So even though I felt successful in that communication, it's double-edged sword. Now I feel like it could be unsuccessful because it's now up to managers, and he just wants to wash his hands from it.
Can you go and do you know who the managers are, and can you follow up with them and be like, hey, so and so sent you this thing? Hey, you know?
Yeah, yes and no. And so last thing I want to do is follow up on it in a way that could be perceived as going behind his back and saying, oh, the safety supervisor emailed you. I want to do that. So I think my next step, looking at the best way to approach it, is to give it a week. That's my standard. If I give the safety supervisor a week, then he's willing to answer my emails. So next week I'll email him again and see if he's got any word from the management. And if not, then I may just informal conversation as I'm walking through the warehouse. Oh, hey, what do you think about this idea? And then if they didn't hear about it, then I know what my next step is.
Yeah, it's those informal conversations where you can actually get a lot of information about whatever's going on out on the floor. You don't have to be talking about injuries or education or anything like that. You just be like, how you doing? What's something you like? How's it going? Has anything changed?
I agree. I think that the informal does a lot better, especially I'm a technical writer, how I classify myself. So my emails can kind of sound brash or just very blunt and forward and cold. And so I think I do better talking to individuals one-on-one to give that nice impression, if you will. What about you, Elena? What's your good success story or struggles?
So I'm at the private high school up here. It's going better. Like, people are getting more accustomed to me, which at this private school, I don't think they really were accustomed to anybody in my position. So, one of my goals was to get a portable AED for the school, because there are several sites we practice or have games at away from the school site that don't have access to any emergency equipment. And I don't always get to go to those sites like all the time, because there's, 2 or 3 other sites I have to be at as well, since it's a high school. But I got a portable AED actually just accepted like today. So it was like really cool. Yeah. I was
awesome.
Like, pumped. So I get to go and like accept the award tomorrow and stuff. So that's like, I don't know, that like made me feel good, because it's been a rough 2 weeks of fall. I don't know, something about like at the middle of soccer season and everything, and just like stuff just starts going downhill for some reason. But yeah, and then the one thing that so that really wasn't an implementation. I mean, it sort of was, but the other thing that I'm being more successful at implementing is like infographics or home exercise programs, because I don't really get to see, since they're high schoolers, they don't follow up with me very often. And so like it might be like a week or week and a half before I see them again, and like some of them aren't consistent because they're young and whatever and they don't care. So I've like been like doing really well like implementing like home exercise stuff, or like giving them handouts and stuff to take home with them, which I think seems to really help them and their parents out. So that's been successful.
What is your policy as far as when you send it home? Do you have a conversation with every parent, just as severe injuries when you are able to?
So severe injuries, yes. So especially anything where they need to be referred, I always try to make sure I contact the parents or the guardians in some way and talk to them. There are a lot of like flaky patients. I'm just gonna be bluntly honest. Like, I don't even know if they're really like being truthful or whatever about their injury, or if they like are just trying to get out of their sport or something. But those kind of patients that are like flaky, and when I tell them that I'm willing to see them such and such a time each day or whatever, and they don't really make an effort to really do what I told them to do or suggested or anything, then those patients I kind of just wait it out. And then those are the ones that I specifically send home exercise programs, because if they're going to be flaky and not like respect my time and meet up with me, then I'm just going to give this and they can do it at home. And then it's up to them and their parents to do it. And some parents are good at making their child, do their rehab and stuff, and some parents don't care. So
Mhm.
it's kind of like, I'm like going mom status sometimes. I'm like, eventually you'll just learn your lesson. So,
Mhm.
but
And that's a hard struggle, especially with that age. I know I struggled with that a lot when I was at that setting, because you don't necessarily want to call every parent at every time, because then it's kind of the, oh man, here we get another call.
right.
And so I think we've all probably been in a situation where we've got to meet parents informally, and that's
Mhm.
definitely the best scenario. But one thing that I was thinking of as you were talking is the flaky
Mhm.
patients. If it's worth kind of just keeping a log for yourself, and on X the next day didn't show up, didn't show up, didn't show up. So that way, if you feel that's the time to call the parents, you can be like, hey, just so wanted to let you know I'm sending your son or daughter home with this home exercise program. We had 4 meetings scheduled and he did not attend any of them, so I just wanted to follow up and make sure that he was at least doing something at home so he can get better on his reported injury.
That's
It can be a 30-second call. It doesn't have to
right.
be long.
That's true. Because I know that, like, I'll write down the list of people that I want to see for a day, and then I
Mhm.
have a treatment log, and so I like officially record people that I did see that day. So I kind of know if they definitely do or do not come in, and I kind of have that record. But that's a good idea about, like, just kind of making the parents responsible too in like the slight way. So
Yeah. Well, not only that, but it's that team approach, right? So if the athletic trainer or the coaches or the parents are all telling the athlete one or different things, they can skate by. But if it's a unified approach, it teaches many good lessons to that young athlete or patient.
right,
One thing I've got burned on before in that setting was I did not document when they didn't show up. And
right.
then parents would come and say, oh, well, he was there and you weren't there. Well, I was there. He wasn't there. He said, she said. So I had to learn the hard way. If you document when they're not there, sometimes that's just as powerful.
That's true. That's good advice. Thank you.
Patient, that is considered best practice according to whatever Beth showed us.
Mhm.
Showing a no encounter is still an encounter
Right. That's true.
if they're your patient already. Like,
That's true. Yep.
but how about like your relationship with coaches? Do you have like scheduled, um, maybe like every Friday or every Thursday or some arbitrary day? Do you sit down with them and say like, hey, these are the athletes who I'm seeing as patients,
Yeah.
and here's just a general rundown on how they're doing or whether or not they're being compliant or whatever information you feel is relevant.
Right. I usually don't have formal meetings, but at least once a week I end up talking to each one of them about like a general overview of what's going on. But like about 3 of the coaches are really good at like keeping tabs up with me as well. But one of them isn't. So like actually I kind of just got burned last week by the one of the soccer coaches, and I found out through the AD that he was complaining about all of his girls having like all these issues, but like I have yet to hear anything from them, or they never approached me about anything. And so, here's the athletic director kind of being the middleman and looking at me and looking at the coach and be like, why is this an issue? And so like now, then I had to like go up to him, the coach himself, and like talk to him like, look, none of your girls are coming to me. So I guess, I don't know, like if they don't come to me, I don't know to like document that they don't come. I don't know that there's issues, but yet somehow I still got burned on that. And I don't know.
So to grow on that, maybe if you're seeing, let's say you're seeing X, Y, and Z, right?
Right.
I'm not good at names. Um, you're seeing X, Y, and Z. You've seen X and Y, and Z has not been compliant. You put them on a piece of paper. You have that paper, or however you document. You have that ready to go. You go out, you meet with the coach, whether it's a formal sit down at a table meeting or it's out on the floor or field or whatever, and you say, hey, we had this conversation. Can you just sign this and just acknowledge that we had this conversation? You're not trapping them into a corner. You're not putting them on the spot, but you're protecting yourself by having their signature saying, we fucking talked about this. So if you come back at me and say that A, B, C, D, E, F, and G are hurt and I'm not doing anything about it, you didn't bring that up during our conversation.
Right.
Or they never came to see me and you confirmed that they never came to see me.
It's true.
So maybe having some sort of signature
Okay.
would be
Yeah.
nice about it. Obviously, there is some grace that has to be implemented, but a lot of times people just be like, yeah, let me sign that. Let me get it out of the way.
Right.
Joke's on them.
That's a good idea. Cool beans.
Maybe Annette doesn't agree with that, but it's fine.
Agree with what?
Exactly.
This means yes, Spencer. I was agreeing with you. I'm very big on personal accountability. And so if you can, I'm not saying pass the buck or put the ball in their court, but almost, I think it was Kim this week that, oh no, you guys weren't there. It was at another meeting last week, but she gave the scenario of a difficult coach or a strained relationship with a coach. And the advice she was given was in her sit down with the coach to ask the coach questions. So the coach had to start thinking through the scenario in her own head. And essentially the coach was able to realize, hey, what I'm asking of you and what I'm demanding isn't feasible. So I don't know if that's a scenario where you can ask coach, this question, like, what do you expect, or what is something that you encourage your athletes with when it comes to injury prevention and injury management? What do you think my role is, or how can I assist you? I'm making up questions.
No, that's a good idea. I think the struggle is right now is that I'm their first full time, so they just they don't know what to do with me. They don't know what I can and cannot do, and I don't even think they know what to expect out of me. I think they just expect me to be at their home games, and then if there's a major injury, then Elena is somewhere around this school, so find her. But other than that, I don't think they even have a clue yet. So maybe by next year obviously I can have these conversations with them, but they'll start understanding everything that I'm there to do for them.
Gotcha.
Yeah. All right. What about you, Julia?
Well, starting next week, my supervisor's gone for 8 weeks because she's having surgery, and there's only 3 of us on staff, and I am the most senior out of the remaining 2 because I have 10 months experience, and the other guy has 2 months experience. So that'll be fun, and I get to present to all the leadership teams, or the button-ups as I call them, and so that's fun and slightly intimidating. But I think it's exciting because I want to be in a leadership role if we stay here long enough for that to happen. And then I didn't really create, somebody else did, and I just pitched it to the site director for these pit stops, which are self-care. So they've got their canes and all that to put out on the floor because of those complaints of people always being busy and can't come in. So we took it out to them so they can use it. So that's getting approved. It already was approved, but now we have to go through the whole budgeting and paperwork process. And then I just applied for a position on my company's workplace safety team, because apparently I'm addicted to applying for positions and things. So I don't know if that'll go through, but that would be kind of cool too.
Would it be with your hiring company or with your client company?
Hiring company, WorkFit.
So with their safety team?
Yeah, so they started a workplace safety team because we take really good care of all of our employees and patients and whatnot, depending on what setting you're in. and we don't really take care of ourselves.
Yeah.
Like, a lot of the employees don't know the emergency action plans, because that's not a responsibility that's ours, really. So we would initiate like maybe a 911 call, but that's about it. All other emergencies are handled through other people. So then we're not like familiar with them. That and like ergonomic workplace setup and all that stuff. We don't do that. For ourselves, yet we will send out the link for other people to have their workstation assessed by the ergonomist and make sure they can get like a sit-stand desk or whatever. So that kind of thing. And then also come to find out, we found this out because my coworker's having surgery. We actually don't have a policy for what to do when people come back for surgeries. So she's going to have like a 10-pound weight restriction when she gets back, but the bathroom door is more than 10 pounds because it has so much pressure on it. It's really hard to open. So, and there's no like policy on what to do for that. But as far as like implementing PROs and things like that I set my goals for, I kind of already started that at the end of last semester, just as like a test run to see what I was going to have struggles with. And really, it's just remembering to do it or having some sort of system to remind me to do it. But I have found that when I do use them, so I'm using the global rate of change and the quick dash. So when I do use them, they're super helpful. Like I was able to use the quick dash and the global rate of change on a patient who wasn't really getting better the way I had expected. But I wasn't sure because his pain wasn't super high, but it should have gotten better. And then we have these time constraints. So 15 days and 45 days are our two time restraints that we have to fall between. But if at any point in there you feel like you're not making forward progress, you should refer on. And so I had him do those two scores, and I was able to see with the quick dash that his score had gotten worse from his initial eval. And then his global rate of change was not where I would have expected it to have been in that time frame. And so I was like, yep, we're referring because I don't know what's wrong with you.
That's good.
So it was kind of cool to see it actually work because, like I said, he's a pretty fit guy. The pain wasn't extreme. It wasn't like an 8 out of 10, but it was enough that it was affecting his daily life. And I wasn't able to resolve it. So, yeah.
I know you're using a quick dash.
Mm-hmm.
I've been trying to mess with, I guess, implementation ideas for mine because I'm in a position where I can't really do anything. I'm very, what I can do is very strict and limited to my EMR system that we have, like our internal EMR.
Ours isn't in our EMR. I keep this on an Excel spreadsheet,
Right.
An Excel spreadsheet.
But what I was thinking was, do you think it would be viable for me to just do the dashed work module? Because it's only 4 questions. I literally only get 5 minutes with every person. That's it. Japanese people, don't ask.
Okay. Maybe. I mean, so that depends because sometimes people are going to have pain that it's like, no, I can work through it. Or like you said, they're firing people for being injured. They're not going to tell you the right answers for that then. But they might tell you that something at home hurts because they're not going to get fired for pain at home.
Yeah.
Fired for pain at work.
Because I'm like completely lost on what kind of things. Like for a clinician standpoint, I'm going to start doing GONI. Screw it. I'm going to do it. That's going to count. But other than that, I have no idea. I know we only have 3 minutes left. Now we're getting.
I'm making a new video or new meeting.
Mm-hmm.
Oh.
Already on it.
But it's like, again, yeah, I only get 5 to 10 minutes because the culture in the company is very toxic. So you can't.
So are you thinking you're going to stay in this position?
If I'm being completely honest, no.
Okay.
A position in Lafayette just opened today, and I sent an email to the chick who's like in charge of it, and she was like,
Wait, what position?
the one I just posted in the group me today.
Oh, I thought that was part of your work.
No, that like I mean it's with my company, but I sent an
Oh.
email to in charge, and she was like, you're gonna stay where you are."
Dude,
So
just come to Lafayette. It'll be a blast.
Because I feel like if you're going to be there for an extended amount of time, you clearly need to make it change for your sanity and for like whoever's next.
so
Or here's the flip side: if you're not going to be there for a long time, then you have the freedom to make the change.
well that's the challenge. Is school versus real life. Like we're expected to implement these PROs and CROs, and I just don't think that's going to happen. I don't think it's physically possible.
I was told, so last semester when I saw the plan thing, I was told I was absolutely not allowed to take any PROs at all because it was Boeing proprietary or aerospace proprietary information, and that I absolutely could not do that, or that I had to submit a complete business proposal to their internal review board to be able to do it. And then after everybody calmed down from freaking out initially, they all figured out that all it was me asking people questions, and it was fine. But like every step of the way with this program, my company, not even the customer, my company flips out, says there's no way you're allowed to do this. Take a deep breath, and then they figure out, oh, this is like what we're doing every day anyway. So like you probably, I don't know. I don't know your situation completely, but I feel like I understand like the DATs inspiring change and all that, and then you have to go back into your real life, but it can happen in real life. Like,
I foresee so many other obstacles though in terms of getting to the point where I am even in a position to implement new things outside of our current EMR. Goni, I can throw into it because it's just part of the assessment, right?
what do you mean outside of your EMR though? Because all you have to do is type Grok score 5, quick dash this score, quick dash module this score into your SOAP note.
I was told that I can't do that and that the auditors will be very mad at me because it goes
Well,
outside
who's auditing?
what they want.
Who's auditing?
I don't know.
Because if it's a physician, they're not going to find anything wrong with that, and that should be who's auditing.
I know it's somebody who does something in my company.